So today's real life Orgo is about painkillers. So to begin, we'll talk a little bit about the history of painkillers. So earliest known records show that the poppy plant seeds, which is where opium, a common source of pain relief, is derived from, were used during the Neolithic age for various rituals, foods, and obviously as a source of pain relief. And then in the 19th century, they were actually able to isolate morphine, which is the active ingredient found in opium, and it's actually also named after the Greek god Morpheus, who is the god of dreams. And they were able to isolate this in its pure form, and this was used widely in a lot of wars, especially such as the American Revolution and the American Civil War. And so the Civil War is actually where we saw a huge increase in the use of morphine and a huge increase in addiction to it as well, because there were a lot of unregulated sales of this medication. And so during this time, several alternatives were created, such as heroin and methadone, but these also turned out to be highly addictive, so it didn't really help avert addiction issues during this time. However, during the last few years of the 19th century, there was a slow reversal of opium overuse, especially with more medical research, stricter laws, and the introduction of aspirin in 1899. And so now today we kind of have two sources of pain relief. We have the aspirins and then the opium derivatives. So here are just some of the common painkillers used today. On the left, we have more of the over-the-counter stuff, such as Tylenol and Advil. And on the right, we have the stronger pain relievers, such as morphine and oxycodone.
Here are the structures of some popular painkillers. The ones in the top row are considered opioids. As you can see, their structures have a lot of similar features that we're going to talk about a little bit later. The painkillers in the bottom row are commonly used as over-the-counter drugs. All of these have some important functional groups, which we're going to talk about in the next few slides. The first functional group we're going to talk about are carboxylic acids. Ibuprofen, which is the active ingredient in things like Motrin or Advil, is considered a carboxylic acid. In fact, its chemical name is isobutylphenyl propanoic acid, because as we know, all carboxylic acids are acids. It's actually also a chiral molecule, and the S enantiomer is considered much more effective than the R enantiomer, but it's really hard to separate them, so it's usually sold as a racemic mixture. Aspirin is also a carboxylic acid, and its chemical name is acetylsalicylic acid. Acetylsalicylic acid, which is really hard to pronounce, but it's a very important carboxylic acid. It has an ester, which makes the molecule have a total of 4 oxygens. Since ibuprofen and aspirin are considered carboxylic acids, they have a lot of similar features and approach the way they treat pain similarly, because they're both considered NSAIDs, which are non-steroidal anti-inflammatory drugs. The next functional group are amines. The morphine family of painkillers, referred to as opioids, have large molecular structures that feature a tertiary amine. Variations on the substituents of these amines create different opioids called oxycodone, Vicodin, and even heroin. Acetaminophen, which is the active ingredient of Tylenol, is also an amine, and it has a secondary amine. There is still a lot of speculation about how acetaminophen works, but most of the evidence points that it has something to do with brain receptors. Unlike the carboxylic acids, these two painkillers have very different approaches to how they treat pain. As mentioned earlier, morphine has a lot of different derivatives, and each one has its own strength and time limit. The ones shown here are only a few. These opioids are used for extreme pain, such as after a surgery, cancer, or nerve disorders. In general, morphine derivatives tend to have at least one benzene ring and a tertiary amine, with a variety of different substituents.
So this is the formation of aspirin. It's the reaction between salicylic acid and acetic anhydride under an acid catalyst. And so what basically happens first is that the oxygen of the carbonyl is protonated, and then that creates a positive charge at that oxygen. However, electrons are moved up to that oxygen, and then that creates a positively charged carbon atom here. And then the salicylic acid adds to that positively charged carbon, and then some rearrangements occur throughout the rest of the reaction to, in the end, create acetylsalicylic acid, which is aspirin, as well as acetic acid. So this is the formation of morphine. So on the left-hand side, you see the total synthesis of morphine, and then on the right-hand side, you see just one specific reaction, the Diels-Alder reaction, that actually occurs in step 2 of the total synthesis. And this reaction here on the right is highlighted because this Diels-Alder reaction with butadiene under high-pressure conditions creates this backbone here with the 3-ring structure that is maintained throughout the rest of the reaction. And then in the last step of the total synthesis, you see codeine with addition to pyridine and HCl create this morphine structure here.
Alright, gang, and now that you know about different painkillers and where they come from, I think it's important to talk about how they work. But before we get to that, we have to talk about how your body responds to pain. So, when you get injured, and I mean physically, not like you just saw your exam 3 score, your body releases a chemical called prostaglandin. Prostaglandin is responsible for inflammation or swelling, blood flow to and from the injury site, including blood clots, and most importantly, it controls the cascade signal of pain. So basically, prostaglandin will bind to its special proton receptor at the end of a nerve cell and then pass along the chemical signal of pain to your brain, and that's how your brain knows that you hurt something. Now, when you take morphine or any other opium derivative, you don't feel the pain. Why is that? Basically, the morphine goes to the nerve ending and it binds to the same proton receptor that prostaglandin wants to bind to. Now, as you can imagine, this causes a problem. Prostaglandin wants to bind to the nerve cell, but it can't because morphine's there. And because it can't bind to the nerve cell, it can't pass along that signal of pain. So essentially, the morphine is blocking that chemical signal of pain, and so you can't feel the pain even though your body is still actually injured. Over-the-counter medicines work differently than morphine and its friends. If, for instance, you were to take ibuprofen when you get hurt, that ibuprofen travels through the body until it reaches the site of the injury, and once there, it reacts with COX-1 and COX-2 enzymes. If you think about it, ibuprofen is working as a deactivating group in this scenario because after it reacts with those enzymes, COX-1 and COX-2 are less reactive. They aren't able to go out through the cell and create more prostaglandin, which is their primary function. So, as you can imagine, if these enzymes aren't able to continue producing prostaglandin, your body is going to slowly stop the inflammation. It's going to stop the blood flow, and most importantly, it's going to stop that pain signal that the prostaglandin is all responsible for. Now, this is in direct contrast to morphine, which, as we said, just completely blocks the signal of pain. It doesn't actually treat any of the things that are causing you to feel pain.
The future of pain relief is actually a lot slower moving than you'd think. This is Carl the cone snail. Hi, Carl. And while his venom is normally used to paralyze fish much bigger than him, scientists have been able to isolate a peptide string in Carl's venom that we can use for pain relief. Let's talk about how that works. Here we have the alpha and the omega conotoxin structure. Look closely and you'll see many similarities with pain relievers. Both have amines, carboxylic acids, as well as benzene rings. They function very similarly. Let's look at that. As we can see in the diagram to my right, conotoxins and painkillers work very similarly. They both block the chemical pathways pain uses to travel from the area of impact to the brain. There are two main types of conotoxins. There's the alpha conotoxin and the omega conotoxin. We've seen both of their structures in the slide previously. The alpha conotoxin works by blocking nicotinic receptors, which produces a muscle paralysis effect that the snail uses to consume its prey. The omega conotoxin is the conotoxin that we are primarily interested in. It works on voltage-gated calcium channels and blocks pain very effectively in human trials.